The other doctors at Fort Bragg Medical Center knew Dr. Elena Rodriguez as the quiet trauma surgeon who worked night shifts and never talked about her past. She was skilled, competent, and utterly unremarkable. Mysterious, what they didn't notice were the faint scars on her hands that came from shrapnel, not scalpels, or the way she instinctively ducked at certain sounds, or how she could assess battlefield wounds with precision that came from experience, not textbooks. Until enemy fire turned the hospital into a war zone and everyone discovered their colleague wasn't just a doctor. Welcome to Hidden Legends. Before we begin this powerful story of hidden service, medical heroism, and the thin line between healing and warfare, tell me in the comments where you're watching from today. And if you believe stories like this need to be heard, hit that subscribe button and help us make sure they are. Fort Bragg Army Medical Center operated with the steady rhythm of a peacetime facility, clean white corridors, the soft beeping of monitors, and the routine hum of a hospital serving one of America's largest military installations. Among the staff of 53 doctors, Dr. Elena Rodriguez was neither the most senior nor the most social. She arrived every morning at 6:30 a.m. sharp, 30 minutes before her shift began. Black coffee, no sugar, medical records review, equipment check, routine, the same methodical preparation she'd followed for 18 months without deviation. The other doctors knew the basics: trauma surgery specialist, transferred from Walter Reed, no family, lived alone in base housing. Dr. Martinez from pediatrics had tried to include her in social gatherings. Dr. Thompson from orthopedics had asked her out twice. Both had been politely declined with the same soft-spoken professionalism that defined everything about Elena Rodriguez. What they didn't see were the details that would have raised questions in a civilian hospital: the way she unconsciously positioned herself near exits in the break room, how her eyes tracked the medical helicopters landing with an intensity that went beyond professional interest, focused, the fact that she could suture wounds with a speed and precision that seemed almost mechanical. Most telling were her hands, steady, capable hands that had clearly spent years handling delicate instruments, but scattered across her palms and fingers were tiny white scars, dozens of them. When Dr. Kim from emergency medicine had asked about them during a surgery, Elena had simply said kitchen accidents and changed the subject. They weren't kitchen accidents, they were the result of operating under incoming artillery fire when flying glass and debris were just part of the job. But that was a life that officially no longer existed. Elena's patient record was flawless. Complicated trauma cases, emergency appendectomies, routine surgeries, she handled them all with the same calm efficiency. Never rattled, never rushed, never showing the emotional investment that burned out so many trauma surgeons. What her colleagues interpreted as emotional distance was actually something else entirely. It was the controlled detachment of someone who had learned to save lives when every second mattered, when failure meant not just losing a patient but potentially losing a mission, a unit, or a strategic position. Because Dr. Elena Rodriguez had once been Captain Elena Santos, 75th Ranger Regiment medic, with 4 combat deployments and a classified record that would never see daylight. Someone who had performed surgery in underground bunkers while mortars fell overhead. Someone who had amputated limbs with nothing but field anesthetics and a headlamp. The transition from Captain Santos to Dr. Rodriguez had been carefully orchestrated. New identity, new credentials, new life, all designed to let a decorated combat medic disappear into the anonymous world of stateside military medicine. For 18 months, it had worked perfectly. She saved lives in clean, well-lit operating rooms instead of dirt-floored field hospitals. She worked regular hours instead of being on call for extraction missions. She slept in a quiet apartment instead of a sleeping bag in a fortified position, until the morning when her two worlds collided at 8:47 a.m. Tuesday morning began like any other. Elena completed her pre-shift rounds, checking on post-operative patients and reviewing the surgical schedule. 3 procedures planned: an ACL repair for a training injury, gallbladder removal for a mess hall cook, and setting a compound fracture from a weekend motorcycle accident. The base felt particularly quiet. Most of the active units were deployed or engaged in field training exercises. The emergency department had seen nothing more serious than a case of food poisoning and a sprained ankle. Dr. Rodriguez, Nurse Petty Officer Jenkins approached with a clipboard. "Your 0900 surgery is ready for prep." "Thank you, Jenkins. How's the patient's anxiety level?" "Little nervous about the anesthesia, but stable vitals." "Private Morrison, 22 years old, first time under general." Elena nodded. At 22, she'd been performing field surgery with nothing but local anesthetics and determination. But Private Morrison didn't need to know that battlefield medicine even existed. She was reviewing the surgical plan when the first unusual sound reached her ears. A distant thump, followed by what sounded like controlled explosions. Training exercises were supposed to be conducted in designated areas, miles from the medical center. Dr. Martinez looked up from his patient charts. "Is that artillery? I thought all the live-fire exercises were postponed this week." Elena's head turned toward the sound with automatic precision. Her brain was already calculating distance, trajectory, and threat assessment, skills that had nothing to do with trauma surgery and everything to do with staying alive in hostile territory. "That's incoming," she said quietly, her voice carrying a certainty that made the other doctors look at her strangely. "Incoming what?" Dr. Thompson asked. Before Elena could answer, the base-wide announcement system crackled to life. "Attention all personnel. Exercise Red Dawn is now active. This is a drill. I repeat, this is a drill. All medical personnel report to emergency stations." The tension in the room visibly decreased. Exercise Red Dawn was a quarterly readiness drill designed to test base response to various emergency scenarios. For the medical staff, it meant treating actors with fake wounds and demonstrating triage procedures for evaluation teams. But Elena's military instincts were screaming that something was wrong. The sounds were too realistic, too close, and following patterns that suggested actual incoming fire rather than simulated explosions. Focused, she walked to the nearest window and looked toward the main gate. Three things immediately caught her attention: real smoke rising from the vehicle checkpoint, actual emergency vehicles racing across the compound with sirens blaring, and soldiers running in formations that had nothing to do with drill procedures. "That's not a drill," she said, turning back to her colleagues. "Of course it's a drill," Dr. Martinez replied. "They announced it on the PA system." Elena was about to respond when her pager, along with every other pager in the hospital, began beeping simultaneously. Not the single beep of a routine page, but the sustained tone that meant mass casualty event. "All trauma surgeons to OR prep immediately," came the voice over the intercom. "Multiple casualties inbound. ETA 4 minutes. This is not a drill. Repeat, this is not a drill." The change in the room was immediate. What had been a calm Tuesday morning became organized chaos as doctors and nurses sprinted toward their emergency positions. But Elena didn't run. Focused, she moved with the controlled urgency of someone who had done this before, many times, under much worse conditions. While her colleagues struggled to process the shift from routine to emergency, she was already mentally preparing for what was coming, because she recognized the sound pattern outside. Coordinated small arms fire, followed by explosive devices designed to maximize casualties and create confusion. This wasn't a random attack or a training accident gone wrong. This was a deliberate assault on Fort Bragg, and the medical center was about to become the most important battlefield on the base. The first casualties arrived at 8:51 a.m., 3 soldiers on stretchers, 2 walking wounded, and a young sergeant who kept insisting he was fine despite the blood soaking through his uniform shirt. "Triage," shouted Dr. Williams, the chief of emergency medicine. But his voice carried the edge of someone who had read about mass casualty events in textbooks, not lived through them. Elena stepped forward. Without speaking, she moved to the most severely wounded soldier, a specialist with multiple shrapnel wounds and signs of internal bleeding. Focused, her hands moved across his body with practiced efficiency, checking pulse points, assessing breathing, evaluating neurological responses. "This one first," she said, her voice cutting through the chaos. "Internal bleeding, possible pneumothorax, or 3 is prepped and waiting." Dr. Williams looked at her strangely. Elena had just performed a complete trauma assessment in under 30 seconds, faster than medics with years of emergency experience. "Dr. Rodriguez," Dr. Williams called as Elena began wheeling the patient toward surgery. "How did you—" Questions later, Elena interrupted. "More casualties are coming." She was right. Over the next 15 minutes, the emergency department was flooded with wounded soldiers. Gunshot wounds, blast injuries, burns, fractures, the kind of trauma that most stateside military hospitals never see. The other doctors were competent, but they were struggling with the volume and severity of injuries. Dr. Martinez was taking too long on routine procedures. Overwhelmed. Dr. Martinez was taking too long on routine procedures. Dr. Martinez was taking too long on routine procedures. Overwhelmed. "Dr. Rodriguez," Dr. Williams called as Thompson was second-guessing himself on a straightforward shrapnel extraction. The nursing staff was professional but clearly operating outside their comfort zone. Elena, however, was in her element. Focused, she moved between patients with an efficiency that seemed almost supernatural. Gunshot wound to the shoulder, cleaned, sutured, and bandaged in 8 minutes. Compound fracture, set, stabilized, and prepped for orthopedic surgery in 12 minutes. Penetrating abdominal wound. diagnosed, triaged, and rushed to emergency surgery in 4 minutes. Dr. Rodriguez, Nurse Jenkins said during a brief lull between patient waves, "I've never seen anyone work like that. Where did you train?" Elena paused in her cleaning of surgical instruments. "Various places," she said simply. But Jenkins wasn't the only one who had noticed. Dr. Williams had been watching Elena work for the past hour, and what he saw didn't match the quiet trauma surgeon he thought he knew. Her technique was flawless, but it wasn't the careful, methodical approach taught in medical schools. It was fast, efficient, and carried the kind of confidence that only came from extensive field experience. She seemed to know exactly which injuries were life-threatening and which could wait, making split-second decisions that typically required extensive consultation. Most tellingly, she wasn't fazed by the chaos. While other experienced doctors were showing signs of stress and fatigue, Elena appeared to be energized by the crisis. But the real revelation came when the power went out. At 10:34 a.m., an explosion much closer than the others shook the medical center. Emergency lighting flickered, stabilized for 10 seconds, then died completely. The hospital was plunged into darkness just as the most severely wounded patient of the day was being wheeled into surgery. "Generator should kick in any second," Dr. Williams said, but his voice carried doubt. Outside, they could hear the sounds of continued fighting, suggesting that whatever was happening was far from over. "This patient can't wait," Elena said, looking at the young corporal on the surgical table. "Multiple gunshot wounds to the torso, significant blood loss, and deteriorating vitals. He needs surgery now, or we lose him." "We can't operate without power," Dr. Thompson protested. "No lights, no monitors, no ventilation." "Yes, we can," Elena's voice carried absolute certainty. "Jenkins, I need your tactical flashlight and any others you can find. Dr. Martinez, manual bag ventilation. Dr. Thompson, you're my second pair of hands. Dr. Rodriguez, this is highly irregular," Dr. Williams began. "So is letting a soldier die because we're waiting for electricity," Elena replied. She was already scrubbing her hands with antiseptic from the emergency supplies. "I've done this before." "You've operated without power before?" Dr. Martinez asked. Elena paused for just a moment. Emergency situations require improvisation. What she didn't say was that she'd once performed a battlefield amputation using nothing but a penlight held in her teeth and instruments sterilized over a camping stove. Or that she'd sutured chest wounds while mortars landed close enough to shake debris into the operating area. Or that some of her most successful surgeries had been performed in conditions that would horrify any civilian-trained doctor. The other doctors watched in fascination as Elena began the surgery. Working by flashlight, she made her initial incision with steady precision. Focused, her hands moved through the patient's abdominal cavity as if she had some form of supernatural vision, locating and repairing damage with speed that seemed impossible under the circumstances. "Clamp here," she instructed Dr. Thompson, guiding his hands to the correct position. "Jenkins, angle that light toward the hepatic artery." "Dr. Martinez, how's his breathing?" "Stable," Dr. Martinez replied, his voice filled with growing admiration. "How are you seeing what you're doing?" "Experience," Elena said simply. But what she meant was that she'd learned to operate by touch as much as sight, developing the kind of tactile sensitivity that came from working in field hospitals where adequate lighting was a luxury. 43 minutes later, she completed the surgery. The patient was stable, the bleeding was controlled, and his vitals were improving. All of it accomplished in conditions that would have made most surgeons refuse to operate. "That was incredible," Dr. Thompson said, as they wheeled the patient to recovery. "I mean, I've been practicing surgery for 8 years, and I've never seen anything like that." Elena was cleaning her instruments when the emergency power finally came back online. In the sudden brightness, her colleagues could see what they had missed in the darkness. Her surgical technique hadn't been improvised or desperate. It had been methodical, professional, and carried out with the kind of confidence that spoke of extensive experience with exactly this type of emergency surgery. "Dr. Rodriguez," Dr. Williams said quietly, "I think we need to talk." The attack on Fort Bragg ended at 12:47 p.m. Official reports would later describe it as a coordinated terrorist assault designed to test base security and emergency response capabilities. 17 soldiers wounded, 0 fatalities, largely due to the rapid and professional medical response. The emergency department finally returned to normal operations around 2 p.m. Doctors and nurses who had been running on adrenaline for 5 hours began to show signs of fatigue, all except Elena, who appeared as composed and professional as she had at the beginning of her shift. Dr. Williams found her in the break room, reviewing patient files and making notes for follow-up care. "Dr. Rodriguez, do you have a few minutes?" "Of course, Dr. Williams." "Private." He closed the door behind him and took a seat across from her. "That was some impressive work today. All of it, but especially the surgery without power." Emergency situations bring out different capabilities in people. Elena, he said, using her first name for the first time in 18 months, I've been practicing emergency medicine for 15 years. I've worked in trauma centers, disaster zones, and military hospitals. What I saw you do today, that wasn't improvisation or rising to the occasion, that was experience. Elena set down her pen and looked at him directly. What are you asking? I'm asking where you learned to perform surgery under those conditions. I'm asking how you knew exactly which patients needed immediate attention and which could wait. I'm asking why you moved through that chaos like you'd done it 100 times before. Elena was quiet for a long moment. For 18 months, she'd been Dr. Elena Rodriguez, quiet trauma surgeon with no past worth mentioning. Today, she'd been Captain Elena Santos, combat medic with 4 tours and more field experience than most military doctors would see in a lifetime. My background is complicated. Military, Dr. Williams asked. Yes, combat. Elena nodded slowly. 4 deployments, forward operating bases, combat outposts, special operations support. Dr. Williams leaned back in his chair. That explains a lot. Your technique, your composure, the way you handled mass casualties. It also explains why it's not in my official record, Elena said quietly. Some assignments don't exist on paper. Dr. Williams nodded. In the military medical community, classified assignments weren't uncommon. What mattered was competence, not paperwork. Well, whatever your background, I'm grateful for it, he said. We saved lives today that we might have lost without your experience. We all did our jobs. You did more than your job, Elena. You led us, and you probably saved that young corporal's life when you operated without power. Elena allowed herself a small smile. For the first time in 18 months, she felt like she'd been able to use all of her skills, not just the sanitized version appropriate for peacetime medicine. One more question, Dr. Williams said. Are you planning to stay in trauma surgery, or is this assignment temporary? Elena considered the question. That depends. On what? On whether Fort Bragg needs a trauma surgeon or a combat medic. Dr. Williams smiled. After today, I think we need both. 3 weeks after the attack, Elena's life at Fort Bragg had changed in subtle but significant ways. Her colleagues treated her with a new level of respect, though none of them pressed for details about her background. Her surgical schedule had been modified to include training other doctors in emergency procedures and improvised medical techniques. Most importantly, she'd been asked to develop protocols for mass casualty events, creating the kind of structured response that would allow peacetime-trained medical staff to handle combat-level emergencies. For the first time since becoming Dr. Rodriguez, Elena felt like she was using all of her capabilities. She could save lives in clean, well-equipped operating rooms while also preparing others for the kind of chaotic, resource-limited situations she'd mastered in combat zones. The other doctors had stopped asking about the scars on her hands. Now they knew what those marks represented. Not kitchen accidents, but the price of learning to heal under fire. Dr. Rodriguez, Nurse Jenkins said one morning as Elena completed her rounds, the new trauma protocols you've been developing, are they based on your field experience? They're based on the understanding that emergencies don't wait for perfect conditions, Elena replied. Sometimes you have to work with what you have and trust your training. Well, I'm glad you're here to teach us, Jenkins said. That young corporal you operated on during the power outage, he came by yesterday to thank the surgical team. He's going to make a full recovery. Elena nodded, feeling the kind of professional satisfaction that had been missing from her life for 18 months. Not just because she'd saved a life, but because she'd been able to use every skill she'd developed, both as a combat medic and as a trained surgeon. That evening, Elena sat in her apartment reviewing medical journals and updating the training protocols. For the first time since leaving the battlefield, she felt like she'd found the right balance between her two identities. Captain Elena Santos would always be part of who she was, the soldier who had learned to save lives under impossible conditions. Dr. Professional, Elena Rodriguez was who she had become, a skilled surgeon capable of bringing battlefield medicine to peacetime emergencies, and Fort Bragg Army Medical Center was better protected because someone had been willing to carry both identities, ready to use whichever set of skills the situation demanded. Because sometimes the best preparation for chaos is experience with chaos. Sometimes the most valuable medical training happens not in hospitals, but in places where the only choice is to succeed or watch people die. And sometimes the quiet doctor who never talks about her past is exactly the person you need when the past becomes the present and lives hang in the balance. So now I ask you, have you ever worked alongside someone who seemed ordinary until a crisis revealed their extraordinary background? Someone whose hidden experience made all the difference when it mattered most? Tell us their story in the comments and let us know what city you're watching from today. If this story moved you, hit that subscribe button to help us honor the quiet heroes who serve in ways we never see. We'll see you in the next story, and until then, remember, sometimes the most powerful skills are the ones hidden behind the most ordinary facades.